I think we'll get started. We have quite a few people in here today. And again, I don't want to waste anybody's time. So hello, you may not know, my name is Morgan Gru. I'm the Bilingual Education and Awareness Coordinator for Ontario. And on behalf of the Youth Cannabis Awareness Program, I would like to thank you so much for joining this panel discussion today titled Cannabis Retail and Community. So I also would like to take a moment to just acknowledge that I'm presenting from the unceded Algonquin and Anishinaabe territory. I acknowledge their longstanding relationship with this territory as the traditional guardians of this land. And I'd also like to pay respect to all First Nation, Inuit, and Métis people who call Ottawa home today. I can't stress enough how grateful I am to speak to you from this region. So for some context, if you're not aware, today's event is a little bit different than other YCAP events that you may or may not have attended in the past. Each education awareness coordinator in our program is tasked with getting involved with their community in something called a community involvement event. And while most of my colleagues chose a cute little event with youth in their direct communities, I took advantage of a virtual world to bring you expert panels on topics I personally and professionally find quite interesting. So thank you for joining me on this personal and professional exploration that we're going to do today. Before we get to the panel, I just want to give you some background on our program for people that maybe have not seen YCAP before or have not been here before. So our program, YCAP, or the Youth Cannabis Awareness Program, is a free national and education prevention program. Our initiative is funded by Health Canada. We're delivered through the YMCA of Greater Toronto all across Canada. We offer these educational prevention programs for youth aged 12 to 24, as well as adults, so people like parents and guardians and professionals that are involved in youth lives. And so in order to increase this knowledge, we're really looking to get these skills out to supporting positive youth development. And what we can do this through is free workshops and webinars. So our entire program is free. We do developmentally appropriate workshops in French and in English. We have provincial partnership committees. So each province has a committee that helps them, guides them through what it looks like for youth programming, cannabis programming. We also have a National Youth Advisory Council. So people 15 to 24 can get involved with giving direct feedback on our program. We have parent engagement opportunities, youth engagement projects. We have a knowledge hub where we've created resources that are great for people to access just directly from our website. And then we have community involvement initiatives like the one you're sitting at today. So thank you for joining me on my first community involvement initiative. If you want to learn more, our website is down below there, or a general email is there, and I'll also put it in the chat at the end of the event. So the last thing I would just want you to know, the Youth Cannabis Awareness Program, who we are. First of all, we are cannabis neutral. So our approach to cannabis is that we don't promote it, but we also don't make value judgments for people that use it in a recreational sense. So, we know that some people may choose to use it, and then we also make people aware of potential risks that come with that. We also have a balanced perspective. So we explore both the uses and the risks of cannabis. Our perspective is always going to be evidence-based. So our analysis and explanations are based on unbiased research conducted through recognized and accredited resources. And we're also informed by best practices to ensure that what we're delivering is effective and engaging for youth and communities across Canada. And then finally, we have a harm reduction approach. So when we talk about harm reduction, especially when we're talking with youth, we say harm reduction doesn't have to be such a crazy concept. Harm reduction can be wearing a helmet when you're riding a bike or looking both ways before you're crossing the street. And so when we talk about it in the cannabis sense, we may say, choosing products with lower THC. We may say refraining from use before the age of 25 because your brain's developing. So there's lots of ways we work harm reduction into our programming. And really, we're just looking to promote strategies that focus on, again, positive youth development, making sure that the information they have is factual and relevant for them. So that is mine. I will stop sharing my screen and I will leave it up to the panelists now to introduce themselves. Maybe we can go organization A to whatever. So we'll start with the AGCO, if that's okay with you, Jeremy.
Hi, thanks very much, Morgan. And I'm really pleased to be able to be here today to share some of the work that the AGCO is doing with respect to regulation of retail cannabis in the province. So my name is Jeremy Locke. I'm one of the directors of compliance at the AGCO, and I'm responsible for oversight of all of our field staff that are out there undertaking the inspections and monitoring compliance and responding to compliance behaviors in all the sectors that the AGCO regulates. I'll share some more about that, exactly all the scope of what the AGCO does in the upcoming slides. Thanks.
Perfect, thank you. I guess we'll go to you, JF at CAMH.
Thanks, Morgan. So my name is JF, Jean-Francois, but I usually go by JF because that's a hell of a lot easier for most people to pronounce. I work at the Center for Addiction and Mental Health, CAMH, in Toronto. And for those of you who don't know, it's both a mental health hospital as well as a research center. And we're also very involved in the development and communication of evidence-based public policy. So my role there is I'm senior policy analyst, and one of my portfolios is cannabis. So I've been involved in cannabis policy for 8-9 years now, and it's definitely my favorite portfolio. I'm very pleased to be talking to you today about cannabis legalization, regulation, etc. And yeah, we'll get into that a bit more in a few minutes, I guess.
Perfect, thank you. Daniel, do you want to go ahead?
Yeah, hi, I'm Daniel Baer. I'm a professor in the Faculty of Social and Community Services at Humber College. And I've been researching cannabis for 16, 17 years now. Started off as a student activist with Students for Sensible Drugs policy and actually medical cannabis patient before transitioning into work around medical cannabis use. I've done work on policing of cannabis, and for the last several years since legalization, I've focused a bit more on public education efforts around cannabis, and I'm currently running an NSERC-funded project to develop evidence-informed public education materials around cannabis for young people. And it's maybe what I'm going to be talking about later, so I'm not going to tell you too much more.
Excellent, thanks. And then over at the OCS, thanks for joining.
It's okay, you don't need to be scared about my name. My name is Daffyd Roderick. I'm the Senior Director of Communications and Social Responsibility at the Ontario Cannabis Store. I joined OCS. I was lucky enough to join prior to launch. And then I guess it's almost a year and a half ago now, almost two, I was given the social responsibility portfolio, which I developed at Hydro One previously. So we have a pretty straightforward strategy. We're focused on advancing cannabis knowledge, diversity and equity and inclusion, and then building the foundations for sustainability, which is something we hear a lot about in the cannabis sector, which is pretty normal for any industry that's so manufacturing heavy. But I'm really pleased to be joining you for this conversation today.
I'm very excited. I'm trying not to be nervous of the people I have at the table with me here today. So thank you so much for your introductions. I think just so we have enough time, I think we'll just jump into the questions now. Jeremy, I know you had some slides. Oh, sorry, JF, I think maybe you have some slides as well. If anybody else has some slides, you should have capacity to share your screen, but just let me know if you want to share and it's not working. We'll figure it out. So we will start with the first question. So this is for AGCO or OCS, whichever one wants to go first. Just explaining to us what your role is in the process of communities introducing cannabis retail.
That's you pointing through the screen at me. So I don't know, Morgan, did you want to bring my slides up, or did you want me to give it a try?
I am more than happy to get your slides up as long as you just tell me when you want me to change it.
Yeah, that's great. Okay, you can flick through to slide number 3, please. And so just really quickly to orient everyone to the work of the AGCO, we're one of Ontario's largest regulatory agencies, and I won't necessarily bore everyone or take up the time with all of the verbatim mandate and everything that we do, but really we regulate the alcohol, gaming, horse racing, and private cannabis retail sectors that operate within Ontario. The cannabis sector is a little bit interesting in so far the fact that you've got a number of players within the space that have different roles within the operation of the sector. And I've got a bit of a chart that I'll bring up later on that will help add some clarity around that. But our regulatory activities are the licensing, registration, auditing, the area that's near and dear to my heart, inspections and investigations, which is the team that I work with. We test gaming equipment for the casinos, officiate horse races. And then another one that's really critical to the work that my team does, and that's the education, training, and awareness campaigns that are focused on compliance. So next slide, please, Morgan. So here's that chart that I was talking about, and this will be a really handy tool for anyone that's looking to dive into who does what within the space. And my friend from the OCS, he'll share with you around the work that the OCS does in relation to the actual handling of the product. That's not really specifically something that the AGCO does. We are there to license and regulate those recreational cannabis stores in accordance with the provincial requirements. Now, there are federal requirements that layer on as well. Ontario and its regulator are primarily focused on the actual operation of the brick and mortar stores and their e-commerce activities that they're undertaking with the click and collect options that are available there as well. And later on, I'll get into how it is we actually do that regulatory work. So next slide, please. So we license the stores, so that's enabling eligible private retail store operators and managers. We then issue what's called the authorization to the stores, and that's what then allows an operator to engage with the Ontario Cannabis Store to be able to purchase product and do that on an ongoing basis to fulfill the orders that the customers have. And then once the store has cannabis on the shelves and they've opened up, the AGCO takes over its regulatory or ongoing compliance monitoring work that we do at the stores through a number of methods, such as inspections, mystery shops, video reviews, audits, all those sorts of things that help satisfy us that the stores are operating in a compliant way. But really, our role is to ensure that public risks associated with cannabis are minimized and maintain that ongoing monitoring of the licensed stores. Next slide, please. So when we think about what's really important to the AGCO and the areas that we really focus on, we've got 5 key themes within the cannabis retail space. Number 1, which is primarily what I'm here to talk to you about today, is preventing minors from buying cannabis that's sold from authorized stores, whether that be in the first instance or helping law enforcement with the information they need to deal with those who might be then diverting cannabis from the actual licensed retail framework. We want to keep crime out of the cannabis market. So we all work together collaboratively, law enforcement, the AGCO, the Ontario Cannabis Store, to support law enforcement efforts to make sure we're trying to combat that wherever possible. We're supporting the building of a regulatory scheme that promotes the responsible sale and use of cannabis. And we arrive at some of that through enforcing the cannabis sales and possession limits, monitoring the advertising and promotion so that it's not happening in a way that appeals to kids. We want to be effective and efficient. We recognize that we're a taxpayer-funded organization, and we want to operate as efficiently as we can to return the most value to Ontario's taxpayers as well in the work that we're doing. And then we want to help support an informed retail network. So we require bud tenders and those working with the stores to have good education and a solid foundation around the laws and the rules that they operate within, and require the ongoing training of staff through the CanSell program. And hopefully that all leads us to a safe and secure sale of the product. So next slide, please. So we've got really 3 key licenses and authorizations that are issued. So there's a retail operator license, and that allows organizations essentially to become eligible to then operate retail stores at the brick and mortar level. So there's the retail operator license that comes first. Then they can apply for the retail store authorization, which is the actual brick and mortar locations where the stores will be located. And once that authorization is issued, as I mentioned on the last slide, they can then engage with the Ontario Cannabis Store to order and then sell product. Then there's also a third license that we issue, and that's the Cannabis Retail Manager license. And this is the individual who is responsible for the daily operations of the store, making sure that the store operates in compliance with the registrar standards and the legislation and the various rules that we have in place for operating those establishments. They're responsible for monitoring staff compliance with the rules, ordering product, receiving product, all those sorts of things that happen in the day-to-day operation of the store. Next slide, please. So the AGCO has a couple of different methods for achieving the outcomes that we would like. We have the legislation, so the Cannabis License Act, and that establishes the registrar's authority to create what are called the registrar standards, which are essentially the detailed rules around how a store is to be operated within Ontario. So you'll see on the screen there, there's 9 key areas where the registrar standards fall within. So things, general requirements, but the physical store requirements. So what's the store actually supposed to look like? What are the measures that we want in place to prevent kids from being able to see cannabis from the street? The secure transportation and storage, minors and prohibited individuals, advertising, promotions, responsible use. All of these are areas that the registrar has broad authority to be able to implement rules through the standards for how stores are to operate. The one key advantage that we have in using the registrar standard system, as opposed to only relying on the legislation, is that we can be responsive and flexible in trends that we're seeing in the industry. Whereas if you were waiting for legislation to be revised, you have to wait for government to have that become a priority, get it onto the order paper, go through that legislative drafting process, and it can take months to sometimes even years to get a piece of legislation amended. The registrar standards allow us, with consultation and the appropriate consideration, to enact changes in a very, very efficient time frame, from weeks to months, when we see an issue that needs some sort of response. Next slide, please. So the AGCO's compliance approach, we are strongly focused on 3 key areas: honesty, integrity, and acting in the public interest. And so we're working really hard to make sure that we're preventing access to cannabis by minors and preventing that diversion of cannabis to the illicit market. So we've got at the bottom of the screen here a number of tools that we utilize to arrive at the expected outcomes. Education is our primary area that we like to spend the most of our time in. We're a compliance-focused organization, as I'd mentioned earlier on. So we work very hard with retailers to get them into compliance and correct any steps that folks take outside of what our expectations are to get them back into compliance. In the most extreme circumstances, the registrar does have the ability to revoke an authorization and essentially require that store to close if they demonstrate a pattern of serious noncompliance or an unwillingness to comply. And all in between the education all the way to the revocation, we have the option for warnings, brief suspensions, orders of monetary penalty, which most of you would probably recognize more as a fine. All of those are things that can be issued to nudge for compliance and have us arrive at a place of both specific and general deterrence. So I think that's my last slide on this question that answers that part, and I'll pass it over to the OCS.
Thanks, Jeremy. So OCS's role, as Jeremy actually helpfully had a slide for, is we are the province's wholesaler. So that means that our job is to purchase the cannabis from the licensed producers in Canada and then sell it on to the retailers that Jeremy's organization, the AGCO, authorizes for the sale of cannabis. Our other role, we have 2 more, is the sale through OCS.ca, which is the website that launched on legalization day and made a lot of news for, as we like to say, we had a cruise ship show up at our lemonade stand and we weren't really able to handle the capacity required. So we've obviously grown a lot as an organization since then. And you know, in April of that year, we had our first 9 retailers open their doors, and we've watched that grow to 1,200 and beyond present day. So, you know, our job is to make sure that, you know, really we want to support those retailers as they get their doors open. The government was very clear with its mandate that it was a free and open market, and that private retailers were to drive that market forward. And I think they've been, you know, we've seen obviously enormous success in moving folks over from the illegal market to the legal market. And, you know, right now we're right at about the 50% mark of 50% of cannabis purchases in Ontario are purchased through the legal marketplace. So it's that role is key. But then the third role is the protection of youth and community. And I think that last one is probably going to be the largest area of interest. As we did talk about cannabis in different communities across Ontario, there's still a number of communities that have opted out of the cannabis framework. You know, I think it's an interesting conversation to talk about what that actually means for their communities. And in the general context, you know, Jeremy, and I don't mean to put you on the spot, but you haven't closed anyone's doors that I'm aware of. You know, we have seen operators by and large operating with high levels of integrity. We are, you know, and I think a lot of the cannabis laws on the books, especially around marketing, were to prevent from going down the road where we saw, you know, alcohol go, where there was a lot of glamorization around alcohol, and you know, the best fun lifestyle you can have is if you're drunk. When we look at the way people are you know, working in Ontario, we really haven't seen many of the fears materialize that were pre-legalization in today. So that gives us a lot of hope. Our focus in relation to youth is making sure that we always operate in an age-gated environment, and then B, making sure we're providing solid educational materials so people can we're working on that right now with Daniel's old organization, Canadian Students for Sensible Drug Policy. We've got an understanding with them that we're going to be doing knowledge translation and dissemination of their materials that's going to support our education hub. So I think that, I'm not sure if that answers your question exactly, Morgan, but.
More than I expected. That's perfect.
All right.
So the next question, thank you so much to both of you, is what is the public health approach for cannabis retail outlets, and what does that look like in practice? And JF, I think I might let you introduce this one, just talk about a public health approach because it's kind of your bread and butter. And then if OCS, if you want to join in on what that looks like in practice, that's up to you, but I'll let you start.
Thanks, Morgan. So I just clicked share screen and it says host disabled participant screen sharing. So what I could do potentially is, if you're able to change that permission, great. And if not, maybe I could email you the slides and you could potentially put them up for me. Does that make sense?
I just made you a co-host, so if it doesn't work, let me know.
Okay, let me just go right back to that. Let's see, I've got the document open now. Yes, excellent. Just a second, there we go. How's that look? Is it up?
Yep,
excellent.
Looks good.
Perfect, okay. So it's a fantastic question, Morgan, and to answer it, I'm just going to give a little bit of context. I'm going to go back in time just a little bit. So when I was hired into my current role in 2012, one of the first tasks that I was given was to look at CAMH's existing cannabis policy positions and recommendations, and basically look at all the, the research that had been done since then, and just figure out if we needed to come out with something new. So in 1997, we had come out in favor of decriminalizing cannabis. So not legalizing, not creating a legal market for cannabis, but just removing criminal penalties from cannabis use. And this is just an excerpt from that document that that the organization released back then, way before I was involved. And I want to draw your attention to, so first of all, I should mention the use of the word drugs here is not meant to be negative or pejorative. It's, think of it as just a synonym for psychoactive substance, basically. So basically, so thing number one here is that substance use should be looked at through a health lens, not a criminal lens. And number two was that the goal of public policy should be reducing harms associated with substance use, but also harms associated with substance use policy. So that's a really key point that basically, for a long time, our society, societies, I think in general, in the West, at least, let's say, we've had this simplistic approach to drug policy where, we have some substances that we allow, even glamorize, as Daffyd mentioned before with alcohol, and we have other ones that we have criminalized and sent people to jail for, giving them criminal records, etc. And, and really it's like rather arbitrary, like what approach we've used, like for different substances. It's just, it's really interesting to look into the history of drug policy and look at the, I don't want to get into that rabbit hole, actually, I'm going to skip that, but like, maybe we can get into that later. Some like the really like racist kind of like basis, for our drug policies in the early 20th century. The point is that like in 97, we were like, okay, decriminalize cannabis, that's the way to go. So when I started doing research, I didn't do this on my own. I did this with a group of about 15 experts across CAMH. And this was kind of our set of guiding principles, basically, was this idea of a public health approach. Now, there are different ways to define a public health approach, but the basic point here is that we're looking to reduce harm. That's the main goal, the harms, as mentioned, of drug use, but also of drug policy. And so in the case of cannabis, we basically looked at this and we were like, okay, so cannabis use, it's not without risks. And especially for some people, either people who are, before age 25, when their brain is still developing, but especially, adolescents, people who use very frequently, people who have a personal or family history of mental illness. Like there are some things that make you at risk, like especially at risk for cannabis related harm. But for most adults, cannabis is less risky than, say, alcohol, So that was one thing that we looked at. And the risks that do exist, well, criminalizing cannabis does not help address those risks at all. In fact, it creates a brand new set of problems when you start criminalizing people and you saddle them with a criminal record, and that affects their ability to find work or to travel. Even worse, law enforcement in the country has been and continues to be very racist. And so the people who were most at risk of the social harms of criminalization were people from racialized communities, in particular Black people and Indigenous people. And so basically looking at all that, we're like, okay, so we are basically better off legalizing and strictly regulating cannabis. Now I'm condensing a year and a half of debate that we had over this into, just like a 60 or 120 second kind of summary. But this is the kind of logic that led us to recommending legalization with strict regulation in 2014. This is the document that I'm referring to in which our recommendations were made. Later, when I'm not presenting, I'll pop a link to this in the chat. Here you see the recommendations that we made. I'm going to wrap this up really quickly, but what I want to say is that with regards to a public health approach, like when it comes to retail in particular, I want to draw your attention to 3 of the recommendations. So one was to limit availability. We talked about placing caps on retail density and limits on hours of sale. Research makes it pretty clear that for legal substances, the more available or accessible you make a substance, the more people will consume it, and the more harm will result at a population level. Now, that's a lot more straightforward for something like alcohol, where basically the illicit market is accounts for a fairly negligible amount, of consumption. It's very different when you're trying to actually replace an illicit market. It's more difficult to talk about availability. Overall, we're talking about the need to make sure that there's a limit on how quickly retail is allowed to grow. And by density, I just mean number of retail locations per geographic area. We also talked about pricing and the need to make sure you could compete with the illicit market while also not having the price so low that you might increase consumption. And so also we talked about a ban on marketing, advertising, and sponsorship. That is something the federal government did, and I think has been one of the great successes of cannabis policy. And on the upper left, there was establishing a government monopoly on sales. So our reading of the research was that, especially if you look at alcohol, it's a lot easier to have, basically the right set of regulations if you have a public entity in charge, yes, of regulation, but also of retail operations. So we had called for an LCBO type entity to be the retailer. That's not what we got into in Ontario, and we can get into the ramifications of that in a bit. But I basically I would sum up by saying a public health approach to retail, in the case of cannabis, the main thing that it involves is realizing or remembering that cannabis is not a regular product. You can't just, have it like milk or apples or whatever, where you just let whoever sell it at whatever price, however and whenever. Basically, you got to remember that it comes with risks. And so you have to treat it accordingly and be okay with things. I see not as much now, but when legalization first occurred, I would see think pieces every other day, some marketing prof, being like, well, why does it make sense to legalize something and not allow advertising? But, like we don't, people like, imagine legalizing alcohol and not letting people advertise it, or imagine having like not being able to advertise bread or something. And I'm like, yeah, but it's a little bit different. Cannabis use comes with risks. Regulation, makes sense in this case. I'll leave it at that for the moment. That's kind of my spiel there. Public health approach involves fundamentally like acknowledging that cannabis is different from other products and has to be regulated accordingly.
Thanks, JF. That was awesome. Anything from the OCS you'd like to add for that question?
Yeah, and I think Jeff, you raised a really good point, and it's all about this balancing act. And we talk about access, and I mentioned earlier we've got more than 1,200 stores open in Ontario, and the original goal of the Ontario Cannabis Store, when it was going to be more of an LCBO style, was around 150. And I think when you are attempting to migrate a population over to a legal, tested, regulated product that operates within the societal framework of, you really have to look more to what we've seen as the most successful piece is, the AGCO's ability to issue licenses and the private retailers' ability to open stores that are converting people over from I would say what was initially a very government resistant legacy marketplace. And we're very careful about how we position ourselves in public. No offense to our friends at the OPP, but we try not to walk hand in hand down Main Street with them because they're a bit off brand. Cannabis consumers don't want a policeman's approach. And I think we saw the negative societal effects of that for years and years and years. And I've had many of those impacts in my own family. I think what we're attempting to do is, and the success of the private retail market in Ontario, I think is a lot about, we've seen people be able to be creative and bring their own concepts of what consumers are going to value. And there's a multitude of different representations in the marketplace. They are all operating under the same sets of rules. And I think relatively successly. Maybe later on there'll be an opportunity to talk about youth access to cannabis and what we're seeing and what we're not seeing. It is a balancing act of access, but access has been the key to migrating the population. So it's one of those tricky ones.
Perfect. Thank you. All right. The next one is kind of a question that hopefully is not going to take too long. Just JF, if you want to talk about if smoking and vaping cannabis is permitted in public places in Ontario and who's responsible for setting those restrictions. And if anybody else wants to join in on that, please feel free. But JF, hopefully you can answer that question for us.
Yeah, and that's a very easy one to answer. Basically, in Ontario, cannabis can be smoked or vaped anywhere that tobacco can be smoked or vaped. This is something that the federal government, there are several areas where they left provinces to regulate. So you have, for example, Quebec, Manitoba, Saskatchewan, perhaps others that don't allow any use in public. From our perspective, that's really not ideal. You're then forcing people to just use like at home where people may not want to be exposed to to smoke or vapor are exposed to it. So in our opinion, Ontario got that right, allowing smoking and vaping of cannabis where smoking and vaping of tobacco is allowed.
Morgan, I'm just going to jump here and say, this seemed like it was a bit of a screw up on somebody's part, because I remember there was a press conference where someone said to Doug Ford, why are you allowing people to smoke cannabis in parks? And he said, wait, that's what? There's a great clip of that out there. And as I would agree with JF 100% that this is a good policy. I know some people say, oh, well, I don't like the smell, but from a harm reduction standpoint, not forcing people to consume at home and then travel somewhere to whatever social event they're going to do while they're intoxicated is much safer to let them, go step out on the street, go step out and be in public. And yeah, we get a little bit of smell of cannabis in the air, but you know what? That was there already. Yeah,
that was all I was going to say, Daniel, is that I haven't, I just anecdotally and from a complaint perspective, we're not hearing of people being any more bothered by the smell of cannabis than or parents having to explain why that skunk just walked by, any more than they had to prior to legalization. So it's just another concern that has really failed to materialize.
For sure. Yeah, that's a great point. And even kind of the idea of maybe people keeping it out of the house, right? So they can step outside if they have children in the house, if they things like that, right? We don't want to be exposing people to that smoke, or children to that smoke as well. So those are great points. Thank you, everyone. All right, the next one. I don't know if this is going to be a fast one or not. Over at the OCS, what should communities know regarding legal and illegal cannabis supplies? And you kind of touched on that a little bit, so I'll let you kind of touch on that.
Sure. So a part of our role, and we work with the AGCO on this, is to account for every single cannabis product that's sold in Ontario. And we report that in through to Health Canada. Each of those products in the licensed regulated framework has what's called a certificate of analysis. And that is done in a regulated laboratory setting where it lists heavy metals, pesticides, insecticides, and it really tells the story from seed to sale. So when you're buying a legal, tested, regulated product, you actually know its provenance. You know where it's been in the production cycle. And I think, we had our very first advertising campaign in the past 2 months. I'm not sure if you all saw it, but it was really about, why would you put something in your body that you don't know where it came from? And it used the analogy of buying meat from someone who just pops by your house. I happen to actually buy meat from a farmer, so it was a bit of a failed analogy for me, but because I do know where that comes from, and I think, but in some ways there are parallels with the legacy market. There are people still buying the legacy market from people who have been trusted partners to them for years, and they do know where it comes from, and they do know how it's grown. Compared to mail order cannabis that we see online, it's not really, no one really knows where that's come from. And I think if you look at the thing that always amazes me, because I've been lucky enough to tour many cannabis facilities and many retailers, it's a massive industry, the legal market. It is worth, there's billions of dollars of investment. There's an equal sized illegal unregulated market. And when I say illegal, I'm not referring to cannabis sold on First Nations. They are a nation. They have the rights of a nation. They really, and I think Health Canada has recognized that, as well as the regulation in Ontario. But we do have a large issue with products, and there also, it comes in child-proof packaging, and I for me, this is of particular importance with edibles. So I live by an elementary school, and this is a product that I picked up the wrapper from the other day. It's Stoner Patch gummies. It's just basically a Ziploc bag that I can get into. A legal product is, I think, as any adult cannabis recreational user can tell you, hard to get into. It requires a bit of work, and it also isn't made to look like a candy that a child should be enjoying. And I think that's one of the huge successes of the legislation and of the regulation, is that these packages aren't set up and marketed to children, to a child audience. And I think that's one of the wins.
Perfect, thank you. Okay, the next question was, what are some successes and challenges around communities adopting legal cannabis stores or opting out? I don't know if you want to touch on that quickly. I feel like it's already come up through kind of other answers that you've provided, but Daffyd, if you want to.
I think it goes back to, we've seen right now, there are still a number of communities in Ontario that are reticent to allow for legal cannabis. I think some of them are wishing for more control over densities and over how many stores they have or don't have. What I think is as an industry and as a society, as access increases in other areas, and they see the benefits in terms of jobs, and we've recently partnered with Deloitte to do a study of the economic impacts of cannabis in Ontario, and I don't think it's any surprise to say they are large and numerous. But I think it's really just a matter of time until communities sort of realize that they're not really preventing harm, they're not preventing criminality, and they're not really taking advantage of some of the opportunities from a taxation perspective to invite legal cannabis into their community. So it's that to me would be the only piece that I would add on that.
Great, thank you. All right, the next question, CAMH, maybe OCS, I've asked quite a bit from OCS, but has cannabis legalization in Ontario been effective at achieving the goals outlined in the Cannabis Act? So 3 of the goals would be combating the illicit market, access to safe supply, and protecting youth. And do we think at this point, about 3 years out, do we think that's been successful or not, or?
I'll let JF go.
Sure. Well, and maybe we can take these one at a time, So like rather than going ABC, I'll just start with the first one, combating the illegal market. So from my perspective, so far, so good. So there was I was just trying to remember which survey it was. It was a Statistics Canada survey of some sort that came out earlier this year that suggested that 68% of people using cannabis suggest that they got at least some of their cannabis from legal sources. That's fantastic. I know a lot of retailers would like to see, and producers, frankly, would like to see that percentage go up. But I think so that was, I think it was 47% the year before, 23% the year before that. So basically, this seems like great progress. And I wish I also had looked into, before today, like how long it took, say, Colorado or Washington to get to, like a certain percentage. Maybe my colleagues on the panel know what those numbers are. From my perspective, we're doing great so far. 68%, fantastic. I'll leave it there.
Yeah, from a progress against the legacy market, I think it's been very successful. We very early on the launch when we were just an online only platform, there was really a sense that this was, and I've been involved with media for a long time, so it wasn't a surprise to me, but it was really declared a failure within the first month, and I thought that was not to be too snide, but it was a little bit adorable. This is a long entrenched industry. People have been doing it and doing it very well for a long time, and I think it was fair to say that it wasn't easy to get. The access was hard because we had up to 6-week delays because we weren't expecting 100,000 orders in that first night. There was clearly an appetite for legal tested regulated cannabis. The product wasn't great. It was unreliable, it was inconsistent, it certainly wasn't of a quality that people were used to. And what we've seen is LPs, licensed producers, listening to consumers, like any good business, finding out what their customer wanted and growing their industry in that direction. So I think from a terms of against the policy objectives and against growing that market, it's been a success so far. I think there is continued, need to continue improving. It's absolutely, there's room for growth. Some of the biggest considerations, like when we at launch, I think we were on average $11 a gram, $12 a gram. We're now down at $6 a gram average, which some are saying is, probably too low. That the other marketplaces aren't going that low. So I think it's going to be interesting to watch what happens over the first 3 years has been a lot of fun. I'm looking forward to the next 3.
And then in terms of protecting youth, does anybody have any thoughts on that? Has that been successful considering it was one of the mandates in the legislation?
So do you want to take that one, JF?
I've been talking quite a bit. Go for it, Jeremy.
So, in the framework that, in our monitoring framework that we have in place, that's one of the key areas that the AGCO focuses on. So we have a couple of programs where we test the system. And the most effective one that we have is we actually have a mystery shop program where we have contracted with a secret shopper company, essentially, that sends in shoppers who are under 25, because Ontario has a check ID 25 policy in place. So essentially there's 2 pieces to our protecting youth provisions. No one under the age of 19 may enter a store, period, full stop. And then anyone who appears to be 19 and 25, the store must validate their age when they're in the store. And so the legislation does allow us to hire and send 18-year-olds in as well to test that. So we've got our program in place where the shoppers go in and they report back to us when they attempted to buy cannabis. Did the store challenge me for ID? We know what the shoppers all look like because our compliance teams, they all vet the shoppers. So the company sends us a stack of pictures of shoppers, and our really experienced compliance folks who have been working as, doing liquor inspections for years and years, they're so skilled at identifying minors in these establishments. They find the shoppers that look the youngest, that it should be pretty apparent to anyone. We get that data back, and I would say based on the information that we're getting back through our failed shops versus the ones where the stores perform well, we have some work to do. The sector has done a really good job, and I think they're outperforming, liquor retail in certain aspects of how they're doing their age gating work. But there's still more work to do, because we're certainly, we're not at zero in terms of the amount of failed shops. And so we need to continue working on it. But what I can say is that the operators, especially the really sophisticated ones, they're not interested in selling cannabis to children. It's not at all in their business interest to do so at all, because what they value the most, well, two things: their brand reputation. They don't want to be seen as operating unethically. And secondly, their authorization from the AGCO, because the premier was very, very clear about the fact that he expects harsh consequences for those that are found to be selling cannabis to kids. And so, that's not been lost on us. And it's where we spend a lot of time focusing with the sector to make sure that they're performing well and meeting the expectations.
I'll just take that from a slightly different perspective, which I think, Jeremy's talking about keeping kids from buying cannabis. I think there's been another side of this, which is that legalization has to some degree normalized, and normalization is a specific sociological term, but to some degree has normalized cannabis consumption in a very beneficial way, in that it's reduced stigma against cannabis consumption, which means that young people may be more able to have conversations with their family about their intention to use cannabis, their current use of cannabis, and so the associated benefits of just being able to talk about this product in a way that does not involve criminalization. I think that there's a real benefit there that we're just starting to see the beginnings of. One of the concerns I do have is that, under the under the Cannabis Act, very serious penalties for providing cannabis to a minor, whereas in Ontario, if you give a minor some booze, and correct me if I'm wrong, Jeremy, on this, but I think it's like a $500 ticket. So one of the things that I would be interested in seeing is that full stop under 19 not allowed in cannabis stores. I'd like to see some variation on that, where young people can go in with a parent who's purchasing cannabis, and it's no longer this hidden thing. It's not potentially stigmatized in the way that when we say you can't even go in the store with a parent, whereas my daughter comes into the LCBO with me, when I get wine and she gets to see that there. So I realize, of course, there's huge challenges in regulating that and ensuring that. And also, I'm very sad to hear that my potential job as a secret shopper just went out the door. This Punim isn't fooling anybody, let's be honest. So, just some interesting thoughts that are away from the actual purchasing of cannabis, just thinking about the normalization, the stigma, which I'm going to get into when I talk about some of the work I've been doing recently.
I think it's a good point, Daniel, in the fact, I don't think any of us on this panel are old enough to remember back in the days when the LCBO, you would walk up to a window, someone would go back into a back room, package your purchase up, and it would come out in a brown paper bag that no one could see. And so I think it's just society's normalization and what they'll accept on, alcohol back on the heels of prohibition. And, society has now gotten to where there's wine retail outlets and grocery stores you can walk in with your kids, although the kids can't pick the alcohol up and carry it to the store. So I can't speak for where government will go with any legislative change, but I imagine as society's tolerance and acceptance improves, I'm sure government will contemplate loosening some of the initial provisions that have been put in place.
Yeah, and at least we haven't gone the way, I mean, you talked about that old version of the LCBO, you left out the part where they had the booklets that got stamped every time you purchase something, and you could be denied if the person said, well, I think you've bought too much gin this month. And I'm looking at your booklet there. And we've also seen the deleterious effects of overregulation in Uruguay, for example, which has seen a much more difficult time bringing people into the legal market because they've very strictly limited where they can sell. And they've taken sort of that old school LCBO approach of like, this cannabis is going to come out of a pharmacy and very limited, you know, we're going to track your name. We're going to keep a very tight lid on who's purchasing that. And that was done, you know, as Uruguay obviously took a first step before Canada, but they've seen a lot of the challenges of coming from that very tight monitoring of who's consuming cannabis. And I think we're also just trying to figure it out here. Yeah.
Yeah, and I know in Ontario, or in Alberta, where the online sales have been completely non-existent due to the fact that they make you go through Equifax and register to become a cannabis consumer. And that was one of the arguments we've had in Ontario on an ongoing basis with some bodies, is that they would like us to put in firmer age gating, because really, how hard is it for a kid to do the math to order cannabis online? Well, the kid needs access to a credit card, and then the kid needs to show ID when the cannabis arrives. So we feel that's kind of a safe spot enough. But it really is, so far has all been about balance, and I think that center of balance is going to shift a lot. And you know, protection of youth. I think there was a study by Sick Kids not too long ago that I think it showed the incidence of cannabis poisonings or poisons reported to ERs had risen since legalization. And I thought this was a really interesting study, and I reached out to them and we went through it together. And what I found out was, well, the period during the study, cannabis edibles weren't actually legal yet, because they weren't available in the marketplace until the second year. So I was like, look, this is a great study, and I think it's really important work to do. However, the piece you're missing is none of these, you know, incidents, ERs, were due to illegal cannabis. They couldn't have been, because it wasn't available in the marketplace, and that was a piece they've missed. So I think protection of youth is really important, but you know, continuing efforts to destigmatize are probably more so, because it really is going to help shape the way we think about it long term. I think we can all agree we want to protect young minds and young brains from cannabis and prevent as much harm as possible. I have a 15-year-old and a 10-year-old, and that's a pretty big mandate for me too.
And I might be beating a dead horse here, but again, I think there's a sign of the normalization there, in that we haven't seen youth rates of use increase. We haven't seen rates overall increase that much, frankly. I mean, it's older men who tend to be reporting higher levels of consumption now. And if we're seeing more people go to the emergency room, what that says to me is potentially people are more willing to, during a bad experience, go seek help because of a lower amount of stigma that they may fear in going and reporting you know, what was an illegal drug that they were consuming. And that's my interpretation of a lot of that data, where we have seen some of those increases. Not entirely, of course, but may explain some of it.
Two quick observations on this question of youth protection with regards to the to cannabis legalization. So one would be that, so as Daniel just alluded to, it's too early to say for sure, but it does seem that cannabis use has not gone up among youth. I'm thinking I'm gonna differentiate between youth under the age of majority, and then people, and then youth who are of legal age to buy cannabis. So, but in both groups, it seems like cannabis use rates have not gone up, and also significantly, it seems that people like youth are using cannabis are not using it more than they were before legalization. Those at the end. Also, it seems like early some emerging research is suggesting that the age at which people use cannabis for the first time might actually be increasing. So that's also a really interesting piece. Now, and none of that is unexpected. When we came out in favor of legalization, we were pretty sure that that would be the case. But one of the, I think, unmitigated successes of cannabis legalization is that now when you know, I mean, let's face it, as much as we, whether it's as parents or whatever, might like for people whose brains are still developing to not use cannabis, I mean, the age group like 19 to 21, I think is the group with highest prevalence rates. So people are using cannabis. And now if they're buying from a legal source, they're actually, they have a regulated product that comes with accurate, reliable information. So someone who, say, for example, wants to reduce their exposure to THC, they can do that now just based on accurate information on the products that they're buying. That's huge. That was one of the reasons why. So when in Quebec, when the current provincial government raised the age from 18 to 21, I think some people in the medical community were just like, oh yeah, developing brain, that's great, do that. But but Quebec's public health community was against that, because then now you're just forcing, people in that 18, 19, 20 age range to buy either secondhand from the legal market or straight up in the illicit market. And so you're kind of back to where you started. Also exposing them potentially to criminalization. We know arrests, it's not the same scene as it was pre-2018, but I think that youth protection, you have to think about it in different ways. And one of those is, like, for people who are using cannabis, they have way more tools at their disposal now to actually, reduce their level of risk when they are using cannabis.
Yeah, Jay's point is spot on. And I would just say, if a young person isn't buying their cannabis from a legal source, we don't have good access to them to provide them the kind of knowledge and education materials which can help them make more informed and healthier choices, moving away from combusted material, moving away from high THC content, considering less frequent consumption. We can't access them. And I think Quebec made a huge mistake there.
Well, I didn't realize that was going to be such a conversation starter, but that was really, thank you everybody for joining in on that, because that was a great, I think, summary of all the points of that. So we do have one, and I think this was one of the questions from the audience, so this actually helps. And Jeremy, this is for you. What is the process for a community to open a new cannabis retail store, which you kind of covered, but what community factors are taken into consideration? So proximity to youth spaces, maybe the number of existing establishments, and then services kind of available in the area. So, and then there's also discussed the measures and standards in place to protect youth from exposure to cannabis retail stores, products, and promotion. And I think we kind of covered that a bit. It is in your slides, so let me know if you want me to share your slides. I know we are kind of running tighter for time, but after this question, it's just Daniel talking about his research. So.
Okay, so well, maybe bring the slides up really quickly, and I'll have you skip through a couple. But number 11 is the first one that speaks to the municipal role. And while it's coming up there, when legalization occurred in Ontario, government was very clear about wanting to give municipalities the ability to opt in or opt out of having cannabis retail stores in their community. And so we were talking about that earlier, about the opportunity for some communities to reconsider that and maybe derive some of the benefits of having cannabis retail operating in their community. They can also choose to implement additional restrictions on that smoking and vaping through the use of their municipal bylaws. So controlling, further controlling where cannabis can be consumed within the community itself. It does not allow for, and there tends to be a lot of dialogue in media about the choices that the AGCO makes when issuing licenses. But it does not allow for municipalities to create their own licensing system for the sale of cannabis, or pass a bylaw that distinguishes a land or building use for cannabis from any other kind of use. So what that essentially means is that if it's permitted use is retail, a municipality cannot impose a further restriction saying any retail except for cannabis. The government was very clear about wanting to ensure that that economic opportunity was there for all those that wanted to get into the market. So if we go to number 12, really quickly, there are special carve-outs for First Nations communities. And I think it's really important to acknowledge the fact that Ontario has signaled to First Nations communities that we want to help bring those First Nations retailers into licensed and regulated framework. So First Nations do have a little bit more autonomy than a regular municipality in terms of what they can include in their band council resolutions. And we at the AGCO have been working really hard with a number of First Nation communities in Ontario, and actually have about half a dozen AGCO licensed and inspected cannabis stores operating on First Nations communities. And we're working together with First Nations officials to go in and do parallel work in relation to the compliance outcomes that we're expecting on those communities themselves. So I think it's a really great news story about the work that we've been able to do together. There's still a lot more to do there, but we'll take the small successes there. So on the next slide, we'll skip this. Well, this one speaks to hours of operation, and the second bullet speaks to proximity to school. A retail store may not be within 150 meters of the property line of a school, and that's a school defined in the Education Act. And so we do have some like private schools that have caused us to have to really think that through, but it's the school definition within the Education Act. And that's one measure that helps to deal with density around vulnerable areas that was put into place, that there is that hard cutoff line there. I think JF was talking about restricting hours of sale. So it can only occur between 9 and 11. And that will also extends to like the click and collect and during the emergency orders that were in place that were allowing delivery. In the proposed bill that would see delivery be a more permanent structure. All of that still must occur within the hours of sale. So even in a new world where delivery could become permanent, you can't call up at midnight and have your cannabis delivered if the store is not permitted to operate. And then on the next slide, there's the eligibility criteria that speak to, essentially, we want to make sure that those operating the stores are of good moral character and will be able to act responsibly within this regulated framework. Next one, and this speaks specifically to that public notice process. So this is in part how the community will know that there's an application for a store on your street corner, in your neighborhood, what have you. You'll see the placard being posted in a prominent location where community members need to be able to read it and know where they can submit their concerns. The AGCO also tweets and notifies our cannabis monitoring distribution list when new applications do come in. And that notice has to be posted for 15 calendar days. And then all of the feedback that comes through the submissions comes into the AGCO, and then on the next slide describes our process. So the submissions have to be in writing. They have to be from residents of the municipality in which this proposed store is located, or they can come from the municipality itself. And so we limit the submissions to the areas that the registrar is permitted by legislation to consider when making determinations around whether a store can be located there. And so protecting public health and safety, protecting youth and restricting their access to cannabis, and then preventing illicit activities in relation to cannabis. And those are really the three main areas that the registrar is allowed to consider when looking at the submissions that there are in place or that have come in. Generally, we found with the submissions that come in, they're ones that when the store or the applicant engages with the community members and talks about what exactly their business plans are, their mitigation strategies, that's been a really effective tool at getting the community involved with these business people that are coming in and trying to resolve those community concerns at the local level. There are no, so to answer the one question that I saw in the Q&A, there are no density limits around proximity of stores to one another, how many stores can be clustered in one particular area. This is not something that the legislation gives the registrar any ability to make determinations about. So if that's something that the community at large wanted to be considered, that would have to be done in the context of legislative change through government. And in our role as the regulator, our role is to implement the government policy that's prescribed through the legislation. And so that's the framework that we are able to operate within right now.
Since I have it up, do you just want to cover this one as well, and then we'll go to Daniel?
Sure, I can. I'll go through this really quickly so that Daniel's time is not all eaten up. But I've covered a lot of these points here. So on this slide, you know, I've covered, I think, all of these items here around the ID checking, minors cannot be employed at any cannabis store. And it's one of the key areas of focus that we have, not only in cannabis, but all of our lines of business where there's, social harms and harms to youth by engaging in most of them. Next slide, please. So the compliance activities that we undertake to monitor for, among all the other things that we're concerned about, but specifically to minors accessing cannabis at the retail level. So there's our unannounced inspections where our compliance officials actually visit the stores in an unannounced way, and they watch what's going on in the store for a period of time. They'll have conversations with the staff, and they'll be monitoring for compliance with the rules around checking ID, challenging folks for ID when they're coming to the register to try to place their order, the check ID 25 policy, all those sorts of things. They'll be looking at in-store advertising and looking to make sure that it's only permitted products that are being sold there. We require all stores to have video surveillance, and they have to maintain that for a period of time so that our compliance officials can come back, or our auditors can come back and actually audit the video with a focus on ID verification and making sure that that's happening even when we're not there. There's our mystery shopper program, which I talked about in pretty good detail before, so I won't spend any longer on that. And then the active monitoring of the cannabis retail stores happens even remotely as well. Through the pandemic, we pivoted to doing virtual inspections. So we've got an infrastructure in place right now that we could call up a cannabis store and engage in an inspection virtually and say to the store operator, I'd like you to show me this element of your business right now as it is while I'm sitting in my room here down, in London, Ontario, and you could be in Ottawa, and I can connect with you to assess for some compliance on a specific point in that point in time. We also will look at, social media posts, look at how their advertising is being conducted to monitor for activities or events that might be appealing to minors. I know when the sector first started up, we saw some inventive marketing ideas around trying to set up to have certain vendors out front of the stores to attract attention when they were about to open. And we really closely looked at all of that to make sure, that what was being offered was not something that would be targeting youth and enticing them to take a greater interest in the store. And then on this slide, there's the retail store educational requirements. We have the CanSell program, which is the only board authorized education in the province right now. And all key staff in the retail store are required to take that training. And it talks about responsible use, again, youth considerations, and that basic cannabis knowledge that we expect of the store operators. And I think that takes me to the end of the prepared content I have. So that's
perfect. Thank you so much. All right, Daniel, it's left to you. And I think you can kind of introduce your research project and what you've been doing. And my two questions that I'd like for you to touch on are just based on your research and experience, what are legal age youth looking to know and how should we approach these conversations? And then with the effects on the developing brain and our overall health, what we know, what objectives has your project set out to educate these youth around, consumer awareness and promoting safer consumption? So I think you're going to cover all that, but those are kind of just the two last questions I had for you.
Yeah, for sure. Thanks, Morgan. We appreciate it. So I am currently leading a project called Engaging and Educating Young Adult Cannabis Consumers, EEYCC for short. And it's funded by NSERC, and it's in partnership with Canadian Students for Sensible Drugs Policy and the Canadian Public Health Association. And I think I'll start probably with your second question there, which is, what are we looking to do? What are we looking to educate young people about? And what our project did essentially was a series of focus groups and a national survey trying to identify where people are getting information about cannabis, what kind of information they want, what kind of sources they trust and where they're going, which sources they're actually engaging with. Then we produced some materials that were created by young people. And then we took those draft ideas to another series of focus groups with cannabis public health people, with people who consume cannabis, with bud tenders. And what we've built out now is a series of materials really targeted at two different sides of the cannabis consumption spectrum. And And the first side is for people new to cannabis or inexperienced with cannabis, or who are very infrequent cannabis consumers. There tends to be a lot of overlap around there. And then the other side are the frequent and experienced cannabis consumers. And the goal for them was to promote harm reduction. And that means different things for different groups. But generally the consensus is, moving away from combusted cannabis products, particularly for frequent consumers, moving away from high THC content products, particularly for younger consumers or infrequent consumers, and really making sure that they're aware of the variety of cannabis products that are out there, but also that they are comfortable with the materials, that they feel they're not being talked down to. Because one of the biggest findings we identified in our research was that young cannabis consumers, and we were looking at people 18 to 30, overwhelmingly kept telling us time and time again, we feel stigmatized, we feel stigmatized, we feel stigmatized. And even from material that really, at first glance was not intentionally stigmatizing or fear-based. We're not talking about, drug ads from Ronald Reagan in the 1980s that, everybody's a pusher and looking to, addict you, right? We're talking about ads from Ottawa Public Health, from CCSA. We're talking about, all sorts of materials that had an undertone of fear of cannabis built into them, that cannabis was this scary thing, that cannabis was potentially a harmful thing. And it's tough, as JF pointed out, cannabis is not a harmless drug. Cannabis, I like to say, cannabis is not harmless, it's minimally harmful, and we can do things to reduce those harms, but we need to be able to honestly talk about it. And so this project, its goal is not to, create a the new cannabis public education campaign that lasts forever. We're trying to get some materials out there created by young people based on their feedback, see how those work and see if they work better than some other materials, and then be able to pass that knowledge on to other organizations there. So, the goal is to identify alternative methods of cannabis consumption and patterns of cannabis consumption that may be less harmful than what people are currently engaged in. That's our primary goal right there. And we have not launched them yet, so I can't tell you the success of that. But what I can tell you, and this goes to your first point there, is what are cannabis consumers of legal age looking for? Well, as I said, we've got two groups that we've primarily identified the big difference in terms of their knowledge needs. New consumers are really interested in understanding the variety of cannabis consumption methods out there. Hell, I barely understand what a dab is. So, it's important that we clarify, these many different forms of cannabis that are available and frequently available now, right? Like you may have been able to get hash in the legacy market, but now you can get hash at any store. You may have been able to get a capsule or an edible at a, from somebody who knew what they were doing back in the day, but now you can get it anywhere. And people aren't familiar with that. We may have legalized 3 years ago, but the knowledge base that people are utilizing for consuming cannabis is, goes back to whenever they began consuming cannabis or whenever they were a teenager. So it's, for the new consumers, they don't understand all these different forms of cannabis. And what's particularly important is that as people are forming their cannabis consumption patterns, we want to have them in the store accessing legal cannabis where they can talk to bud tenders who can talk to them about, what experience are you looking for? And not necessarily this one will make you happy, this one will, cure depression, but more, what's your time frame that you have? Do you have 5 hours that you want to be high for, or do you want a shorter duration? Do you want this to have a quick onset, or do you want you're okay waiting an hour? If we can connect them into that knowledge base of bud tenders and provide them supporting information that's based on trusted sources, new cannabis consumers and infrequent cannabis consumers are really looking for that encompassing knowledge base that they don't have. And one of the ways that we're responding to that is we're pitching materials or putting materials out there into the stores. We're going to be working with a licensed producer has agreed to sort of give us some introduction to some stores. They have relationships, and we're hopefully going to be getting into some retail stores and having them have this public education material available, but also directing people to the website. One of the things we identified, particularly for, actually I should say this one is across the board, but one of the things we identified is that people want information from trusted sources. And they rated government websites, professors, journal articles, all of these things they rated with very high trust levels. But we found that they were not actually engaging those sources very well. They weren't looking at Health Canada materials. They weren't going to CAMH. They weren't talking to academics in their lives or their professors, right? They were talking to their friends. And even though the trust level for friends is much lower, they were seeking out their friends much more frequently. And so the sort of the tone we've tried to adopt is, like the older brother friend at a party who kind of knows what they're talking about, but has like actually a list of journal articles that they can turn to. Because it turns out that if you say, hey, you should be thinking about this, and here's this journal article, or here's this report from a trusted source that kind of backs this up, the people actually seem to be fairly responsive, and they like that attribution to an external source. I'll share a couple things real quick. These are a world premiere here. Actually, let me see if I got to get the right one open. I think this is it. There we go. These are some of the posters that will be appearing. And we worked hand in hand with design students and advertising students at Humber College. And when we took these ideas to focus groups, so these are all, been viewed and developed by young people for young people, really making sure that cannabis consumers were part of this throughout. And again, it's about engaging them from peers and knowledgeable sources who they can relate to. And so this person is a barista. All of our archetypes, not characters, we call them archetypes. All of the archetypes have a background that a young person might have that they can relate to. And in case this is too small, it says, what should you know before consuming cannabis for the first time? For Ava, a nug novice, it was important to find out. And Ava says, when I decided to consume cannabis for the first time, I didn't think there was a lot to consider prior to consuming. Then I found a first-time checklist that discussed the importance of knowing the purpose of my consumption, deciding which method is right for me, and many other factors. Now I feel more confident in my choice to consume. Ava is there alluding to a couple of things that are supplemental materials that we've developed, but it's a first-time checklist which asks people, why are you consuming cannabis? What do you want out of this experience? What do you expect out of this experience? What are your concerns? Here are sources that direct you based on that information so that people can feel that they have an understanding and that they're intentional in their drugs consumption. And that's one thing that I think is missing from a lot of public education information about drugs, is that people are intentional in their drugs consumption. And if we can acknowledge that, destigmatize that, and acknowledge, hey, you might be feeling some anxiety, you're thinking about consuming cannabis, and that's not the worst thing in the world, but here are other resources that you may want to think about if your intention here is to deal with anxiety. Let's make sure you understand the breadth of opportunities to you and that you don't feel that this is the only thing there. And if you are choosing to consume cannabis because of, and I'm using anxiety again as the reason, if you're choosing to engage with cannabis because of anxiety, here's how to be intentional in that. To think about, if you're consuming too much, if you're relying on cannabis to deal with larger mental health issues, here are ways that you can deal with that and not feel stigmatized in that decision. So I'll throw you a couple other PDFs here that we've got. You might recognize this handsome gentleman here, who's also named Daniel, and is supposed to be the professor archetype. I swear I didn't make them do this, but my design RAs did this. And this is a common misconception of like, oh, I tried cannabis and I didn't get high the first time. And my dad famously tells a story of 1968 and someone passing him a joint and him saying, well, I don't feel anything, I don't get it. And this is a thing that many people experience. It goes back to Howard Becker writing about this in 1953 on becoming a marijuana user. This is a phenomenon that is much older than cannabis legalization. And so it's something that we need to talk to people about. Yes, you might not feel high your first time. You don't know what it means to feel high. So some people do, some people don't. And so we have these explainers and this idea of like walking people in. And, Morgan, you said at the beginning of this that you really focused on being cannabis neutral. We're kind of cannabis neutral with a bit towards the, like, it's okay to talk about this, to destigmatize this. And I think that that's an important aspect that so much of, at least, pre-legalization, especially, so much of the drugs discussions really left out. I'll give you one more here. Again, the world premiere of these. And this goes back to something we were talking about earlier with Daffyd and Jeremy, with the legally produced cannabis and why it's better. But again, as you can see, we're hitting the same points here. You can purchase legal cannabis products from authorized retailers with the help of bud tenders like me. Legal cannabis products are required to come in childproof packaging. Unlike with illegal products, legal cannabis producers are required to have a clear description of the contents in the label. These producers are strictly monitored, and their products undergo strict testing for toxic and harmful substances in licensed laboratories to ensure your safety. Really avoiding any sort of like, cannabis is great, you should all consume cannabis. We're not going down that side of this. We're not advocating cannabis here, but we're acknowledging that many young people are going to try cannabis at least once. And if there's if they're trying to understand, well, why should I go here instead of that weed that my uncle grows behind his farm, where what are the reasons to do that? Here's very plain language, not stigmatizing, acknowledges the value that bud tenders provide, acknowledges the legal framework having benefits to individuals. So just to circle back to the main question here, what are they looking for? It's to be talked to about a subject that carries so much stigma still to this day. It's to be talked to without that stigma. And basically every aspect of our research in the focus groups, at least, came back to a question of feeling stigmatized, feeling othered, feeling different or looked down upon because of their cannabis use. And that having a very quick knock-on effect to anything associated with that. So anything that felt like it was perpetuating that stigma or hinting at that stigma or hinting at that other thing lost value, and they didn't want to engage with it, no matter how valuable or clear that information might be. And I'll give you an example. We created a couple drafts of some posters that we showed young people. And it was, it said something like, Jeremy, a realtor who sells way overpriced Toronto homes and makes a killing doing it. Even Jeremy smokes cannabis. So you can be successful. Don't worry that you're not going to be successful just because you consume cannabis. Like, going with this whole fear of like, you're going to be a loser and a stoner, if you try drugs. And people were like, no, like, I get it that, yeah, successful people can consume cannabis, but this is still really talking down to me. And I feel like you're telling me like, there's a good chance I might be. Look, you might be that lucky few who consumes cannabis and makes it successfully. And so we pulled that. We got rid of that poster because it was still very stigmatizing. It was obviously not very well written, and I'm paraphrasing here, but you can see, I think the biggest issue is just not stigmatizing people, making sure that young people who feel that they want to consume cannabis, or young people who are consuming cannabis, feel okay to talk about it, feel open. And I'll just give one final example. I know we're running out of time here. I remember in June after legalization, I went to a Fish concert at the Budweiser stage in downtown Toronto. And for those of you who don't know, Fish, PHISH, is a large jam band, sort of like the legacy of the Grateful Dead carrying on. And at a Fish concert, it is not at all uncommon for people to be passing joints down the aisle. And I realize that, in the age of COVID, that sounds just like absolutely horrible. But pre-COVID, it was like totally normal. And I went to the concert and someone passed me a joint and I took a puff. And I was at a meeting the next day of people, of senior academics. And, oh, yes, it's a good point. I should mention the second group of youth there. But I was at a meeting of like senior academics, almost all of whom I had gone drinking with, and several of whom I knew consumed cannabis. And someone said, "Oh, Daniel, you went to the concert last night. How was it?" And I said, "Oh, it was great. You had a great time." And people were passing joints down the aisle. And when I said that, everyone was like, "Oh, I don't think we're allowed to talk about that. Like, that's not okay." And I'm like, I know you consume cannabis. I know you consume cannabis. I know you consume cannabis. And I've gone drinking with the rest of you. Like, in my head, it was just like, oh my God, if they're doing that to me and I feel so stigmatized as like an occasional cannabis user who's almost 40 and like holds down a full-time job with a doctorate, like, imagine how it must feel to a young person to feel that. So I just use that as an example of like why we need to be really conscious of that. Someone pointed a question there. What's the second group of cannabis consumers? I didn't focus on them too much, but those are the very frequent cannabis consumers. And those individuals are really interested in understanding, from our research at least, alternative consumption methods that meet them where they're at as a consumer. So they might say, well, I consume regularly and I sort of consider it, half recreational, half medical. So I want to be able to self-titrate my dose. And, I've been smoking joints my whole life, and I smoke, 5 times a week. And they want to understand what alternative products are there that they can access. And just, are there any real benefits? Obviously, many of those very frequent cannabis consumers know of the existence of alternative products. They want to understand the actual benefits they might reap from switching, let's say, from joints to a dry herb vape or an oil pen or something like that. And actually what the science is behind it in a way that is, not stigmatizing.
Awesome. And Daniel, there's just one question about when these resources will be available.
So those should be available. We're planning a launch at the end of January. And then hopefully you'll see them start popping up in retail stores with information being passed out to people at the retail stores so they can access additional information, and then pamphlets as well in the retail stores. Right now we've got 2 main pamphlets that are designed for in-person physical handout. And one is like a first-time beginner's checklist and guide. And the second is for frequent or regular consumers who are looking to consider alternative forms of consumption, particularly away from combusted cannabis. Again, combusted cannabis is not like the world's most dangerous thing, but if we can move frequent consumers away from some combusted material long-term, that probably has some benefits to it. And these will be, we'll be doing a social media campaign. It's going to be called, oh God, what do we settle on? Oh, Weed Out Misinformation. Yeah, that was the final choice. So it'll be a Weed Out Misinformation campaign. There'll be some online there'll be a lot of social media content. There'll be a website. And then hopefully, depending on our ad budget, you might see some ads pop up here or there, but yeah.
Excellent. Well, we're at time. Sorry, questions did come through while we were talking. So I'm sorry if anybody has any questions, feel free to email them. I'll put Emma, if you want to put my email in the chat, and then I can send them to the panelists if there's something specific, any burning questions. But thank you so much to everybody for joining. Thank you so much to my panelists. This was amazing. I'm so grateful for having you here today. This was very cool, and I've never been a part of something like this. So thank you so much.
Thanks for the invitation, Morgan. And thanks, everybody.
Cheers.
Daniel, that's a great campaign. I thought you were going to tell us that the kids were freaked out that they might become real estate agents, which I was like, yeah, that'd be terrible.
No, they're just freaked out about real estate.
No, but thanks very much, Morgan. Thanks, everybody.
Yeah, thank you.
Thank you.
Cheers. Thanks, everybody, for coming.
Yeah.
For anybody still on the line, I'm just going to share some resources. If you want to know if you're talking to any youth in your lives, we obviously have our website. We also have the EE.net, which is where this event was posted and advertised. So that's a great resource as well. We have services across Canada, because I know there was people from all across Canada here today. Here in Ontario, Connex Ontario is an excellent resource that you can connect youth with, or you can connect with yourself. They have mental health resources, cannabis resources, things like that. We also always encourage people to, use Kids Help Phone. They have the texting, they have the website. They also have calling that you can do. Good to Talk has support services in Ontario and Nova Scotia for post-secondary students. So that's a great resource as well. But otherwise, thank you for joining us. We got cut short here, but if you're still on the line, you can always message me. My email is in the chat, or go to our website. We also have workshops. So we have Let's Talk About Cannabis, which is a youth presentation. We have Cannabis in the Adolescent Brain, which is another youth presentation. We have Youth and Cannabis Use Landscape in Canada, which is coming up at 3 o'clock. And we have Talking to Youth About Cannabis, which is another adult-focused presentation on how to have these conversations with youth, happening tomorrow at 6 p.m. So we also have youth engagement opportunities. We talked about the partnership committees, the Youth Advisory Council, and cannabis awareness projects that we do all the time as well. So thank you so much to everybody. If you're still on the line, I appreciate you sticking around. Thank you so much for joining me today.